Provide privacy. Hi Delaney, my name's Jenny. I'm a nurse practitioner student and I'll be doing a head-to-toe assessment on you today. How are you?
Good, how are you?
I'm good. I'm going to wash my hands quickly. Okay, it looks like my medical assistants took your vitals before you came in. Your blood pressure was 120/80. Your heart rate was 59. Your temperature was 98.1 orally. Your oxygen was 99% on room air. Your height and weight are normal for your age and your height, BMI. Can you tell me your name?
Delaney.
When's your birthday?
August 17th, 2001.
Do you know what year it is?
2024.
Who's the president?
Joe Biden.
Okay, perfect. We'll get started. Now I'm going to put on some gloves and I'm going to assess your hair, your scalp, and your face, okay?
Mm-hmm.
I have gloves on. I see no balding of the hair, no lesions. Scalp feels symmetrical with no indentations. Face looks symmetrical with no scarring, no abscesses. Okay, now I'm going to test your cranial nerves. Can you raise your eyebrows for me, up and down? Perfect. And can you close your eyes really tight? Perfect. Can you stick out your tongue and move it side to side? Thank you. Can you puff out your cheeks? Okay, can you smile really big for me? Perfect. Now I'm going to assess your sinuses. Perfect. And I'll assess your lymph nodes. Okay. Now I'm going to assess your eyes, okay? First I'm just going to have you follow the gaze of the tip of my pen with your eyes, okay? Perfect. Now I'm going to look at the back of your eyes. Reactivity. Okay, now I'm going to see how your pupils respond to light. Perfect. Now I'm going to test your eyes for distance. I'm going to hold something from further away and I'm going to have you read the bottom line for me.
ENRTQ.
Perfect. Now I'm going to assess your ears. Looking at the ears, I see no deformities, no discharge. Can you hear this?
Mm-hmm.
Perfect. Okay, now I'm going to look inside your ears. I'm going to pull the ear up and back so I can look inside. No redness, no swelling, no lesions, no discharge. Now I'm going to perform a tuning fork test on your ears. I'm doing the tuning fork test. And I'm going to assess the lymph nodes in the head. Now I'm going to test and assess your nose. Looking at the nose, it is symmetrical with no lesions or bumps. There is a piercing present that has no infection. Now I'm going to test the patency of your nose, so go ahead and sniff in. Perfect. Now I'm going to test your smell. Okay, close your eyes for me and let me know if you can smell anything.
Yes.
Perfect. Now I'm going to look inside your nose to ensure there are no lesions or sores or drainage out of the ordinary. Perfect. Now I'm going to assess your mouth. Looking at her lips, they are symmetrical and there's no deformities or no abnormalities. Can you open your mouth for me? Looking inside, there are no sores or lesions. Now can you stick your tongue out and say ah? No redness in the back of the throat. Neck and your thyroid. Looking at the neck, it is symmetrical and there are no abnormalities. When assessing the thyroid, I feel no lumps or bumps that are abnormal. Can you slightly tilt your head back and swallow for me? Symmetrical swallowing. Now I'm going to assess your lymph nodes in your neck. I feel no lumps, bumps, or abnormalities. Now I'm going to assess your cervical lymph nodes a little lower. I'm going to move your shirt slightly. No lumps, bumps, or abnormalities. Now can you put your head forward for me? Okay, now can you tilt your head back? And can you tilt your head from left to right? Perfect. Now I'm going to assess your chest and your lungs. Can you take a deep breath in and out for me? Shoulders are symmetrical and expansion is equal. One more time. Chest is also symmetrical with expansion. Now I'm going to listen to your lung sounds. Just give me a few deep breaths. I listen to all quadrants, upper, middle, and lower of the back. Okay, now I'm just going to have you breathe in and out. And I'm going to have you say a phrase, I have to go shopping.
I have to go shopping.
Okay, that was testing of tactile phrenitis. Okay, now I'm going to have you say E while I listen to your lungs.
E, 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 E.
Okay. And that was testing egophony. I turned the lights on so I can better inspect your neck for the JVP and your carotid. So I'm going to have you turn your head slightly to the left. And now as she breathes, I can see this opening and filling and closing, and I can palpate. Okay, you can put. I'm going to listen for any irregularities or any murmurs. Now I'm going to switch to the bell side to listen to the fourth and fifth. Now, I'm going to locate and palpate the PMI near the fifth intercostal. Okay. I'm going to percuss over the borders of the heart. Now I'm going to assess your upper extremities. When I look at the skin, it is appropriate for ethnicity and age. The skin is taut, there are no lesions, there is no swelling. Now I'm going to assess your range of motion. Can you raise both of your arms out in front of you? And can you put them down? Can you raise your arms above your head? And can you put them down? And now can you hold your hands out in front of you? And can you turn your palms upward? Okay, and you can place them back down. Now I'm going to assess your capillary refill. We want it to be less than 3 seconds. Capillary refill is less than 3 seconds. Now I'm going to assess your radial pulse and your brachial. Okay. Now I'm going to have you shrug against my shoulders to test your strength. Now squeeze my fingers. Okay. And can you push against my hands? I'm going to assess Tinel and Fallon signs. Can you please hold out one hand? Okay, I'm going to push on the nerve. Do you feel this radiating to your fingers?
No.
Okay. Now I'm going to have you put your hands together in a downward facing motion. Perfect. When I assess the nails of the patient, there is no clubbing or other irregular signs. Now I'm going to assess your abdomen. When looking at the patient's abdomen, there is no swelling, there is no tenderness, and there is no obesity present. Now I'm going to listen to all 4 quadrants of your stomach. All 4 quadrants have active vowel sounds. Now I'm going to palpate. The patient is not experiencing any tenderness or guarding with palpation. Now I'm going to assess all 9 areas for tympany and dullness. Now I'm going to assess the appendix for any rebound tenderness. Going to palpate to assess the liver, if there's any enlargement near the right and third intercostal. Okay. Now I'm going to assess for ascites. There is no dullness, no fluid waving. Okay, now I'm going to have you sit up. Now I'm going to test for kidney tenderness. Any pain with palpation?
No.
There is no dullness. Now I'm going to assess your lower extremities. When looking at the patient's lower extremities, I see no lesions, no abnormalities. There is no swelling or edema present. Now I'm going to assess your pulses. I'm going to assess your femoral pulse, your popliteal,
Posterior
your
tibial,
radialis,
dorsalis
and your
pedis,
dorsal. Okay. Now I'm going to have you try to kick against my hands. Lift your feet up. Okay, now pull back. Okay, now extend your knees completely straight out and put them back. Perfect. Okay, now I'm going to have you lift your toes towards you and now point them straight. All right, now I'm going to have you stand. Okay, I'm going to have you bring your leg, your right hip outward. Okay, and back in. Same with your other leg. Okay, and back in. And now can you bring it across your body, your right leg? Okay, back in. And same with your left. Okay. Okay, now I'm gonna have you turn to your side. And can you curl your leg backwards at extension at the knee? Yes, okay, perfect. Next. Okay. And now I'm going to have you do that against resistance. Okay. Perfect. Okay, you can sit back down for me. Okay, next we're going to a neurological test. I'm going to have you close your eyes. And now with your right hand, I'm going to have you touch the tip of your nose. Okay, and now same thing with your left hand. Okay, now I'm going to have you place your hands flat on your legs, and I'm going to have you, as fast as you can, flip your hands over. Perfect. Next, I'm going to have you do a heel to shin test. So for example, you'll take the right heel of your right foot and you're gonna have it scrape against your left shin while with your eyes closed. Okay, now can you do the other leg for me? Okay, perfect. Next, we're going to do sensations. So I'm gonna have you close your eyes and I'm going to either use a dull side or a sharp side and you're gonna tell me which sensation you feel and where.
Dull.
Okay, and where was it located?
Right hand. Sharp. And the left hand. Dull on the right leg. Sharp on the left foot.
Okay, perfect. You can open your eyes for me. Next, I'm going to test your tendon reflexes. Now I'm going to assess your deep tendon reflexes. I don't have a hammer, so I'm going to be speaking this through. First, this would be assessing the bicep tendon. So when I strike with the hammer, we would see a slight contraction of the muscle. For the tricep, same thing. When I strike with the hammer, we would see a contraction of the muscle. For the patellar, with the hammer, when we strike, we would see the reflex. For the wrist, I would find the nodule here in the wrist, and when I would strike with the hammer, we would see the muscle twitch. And for the Achilles on the back, when I strike with the hammer, we would see the muscle react. Now I'm going to look at your musculoskeletal structure. Now I'm going to palpate the patient's spine, cervical, thoracic, lumbar, making sure there is no tenderness or pain. Okay, now I'm going to have the patient bend and touch her toes, and I will watch her spine as she does so. Okay, there's no abnormalities, no bulging. Now I'm going to have you bend slightly at your knees so I can observe your knee bend. Okay. Now I'm going to have you do flexion, extension, rotation, and lateral bending. So I'm going to have you bend down and touch your toes again. Okay, now lean backwards. Okay, now can you turn from side to side? And lean side to side. Okay, now I'm going to have you just walk down and walk back to me so I can observe how you walk. Okay, the patient is stable. Now I'm going to have you walk down and back, but only on your tiptoes. Okay, now I'm going to have you walk down and back, but only on your heels. Okay, and now I'm going to perform the Romberg's test. So I'm going to have you close your eyes and stand here. This test would be 60 seconds in total, and if the patient swayed or could not do this, that would be a positive sign, which would not be good.